Good day, everybody. My name is Suzanne Gelderblom, and I'm one of the psychologists at Stabilis Treatment Center. So today I want to discuss something that happened in group therapy yesterday. As I'm sure you're well aware, I am one of the psychologists at Stabilis Treatment Center, like I mentioned before. So I facilitate the group therapy sessions on a regular basis. Where we discuss various topics related to substance abuse. And interestingly enough, yesterday we had the topic of families and the impact of substance abuse on significant others, on family members, spouses, etc. And one of the discussions that came about during the group session was from the addicts present in the group who made or who raised certain concerns in terms of the way forward and how should they rebuild the trust relationship, knowing very well that when they go back home they're going to need the support of their families. And during the discussion, interestingly enough, some of the behaviors and the reactions that families of addicts have was brought up in the discussion. So I'd like to discuss some of these today, because I think very often the focus lies with the addict. They are the ones that receive the treatment. They are the ones that often are taken into some kind of a facility to address the addiction problem, and the families gets left behind, and they are literally left sometimes in the dark in terms of what is the way forward. How do I support my addict family member after rehab? Now, I'm not going to necessarily discuss what you should do. I'm actually more going to discuss what are some of the mistakes that some of the patients in group therapy mentioned yesterday that they feel their family members make. So obviously, mistakes is a harsh word, because I don't think in terms of dealing with substance dependency as a family member who is affected by the abuse themselves, that there's necessarily a right or wrong way. This is always what I also say to the family members as well as to the patients themselves, is that you need to communicate what is going to work for you. There's not necessarily a generic response or a generic recipe that we can give you guys in terms of what's going to work and what's not going to work. But however, I'd like to discuss some of the things that was brought up in the discussion yesterday with the patients that are currently in treatment. Some of the things that they have mentioned that they struggle with in terms of their recovery. And I'm sure you would all agree with me that living with an addict whilst they are abusing the substance and even after rehabilitation is extremely difficult, because you yourself as the family member go through a lot of emotions, from maybe feeling angry, resentful, to wanting to help, to wanting to rescue, wanting to just fix the person and fix the problem. And I think that's exactly where the problem lies, is that often results in the family member taking accountability, taking responsibility, and the addict not necessarily taking the responsibility to fix the problem themselves. So let's look at some of the mistakes that was brought up and that was mentioned in group yesterday that we discussed. First one, which I'm sure all of you would probably have predicted would come up, is judgment of their behavior, judgment of the fact that they have a dependency problem. So what is the mistake or the problem with judgment? Unfortunately, we need to realize that an addict didn't ask to become addicted to a substance. So it's not something that they planned, or that they necessarily even predicted would happen, but it happened, and now they've got this chronic condition, and they need to learn how to manage it, and they are going to need your support going forward. But if judgment and blame is going to be the way that you're going to be dealing with it, it is unfortunately going to just reinforce negative emotions with the addict. Feelings like, I'm never going to be able to do this successfully. They are never going to trust me. I'm always just going to be seen as the alcoholic, or the failure. And so when you judge, you make it quite difficult for them to actually feel motivated or encouraged at all to start dealing with this problem. And it will influence their ability to trust you, to go to you when they are in need of trouble, of support. So therefore, I think it would rather be good if you can try and be supportive to them and say, I understand that there will be days that you will be craving. I understand that there will be days that's going to be quite difficult for you. And I'm open to you coming to me and speaking to me whenever you need to, rather than necessarily judging them for just being an addict and not ever being accountable or responsible for anything. The second mistake that the patients identified yesterday was not learning about addiction. Okay, so this was very interesting to me, because I think, me as a psychologist and a therapist working with addiction and working with people with substance use disorder, we often focused on trying to get the patient to gain insight into their addiction and the reason for developing addiction and the function of the substance in their lives. But it was interesting to hear from them yesterday that they felt that their family also needs to gain insight into what are they dealing with on a practical level. So what does it feel like to crave? How does it impact your daily routine and your daily life, knowing that for today I have to maintain sobriety, whatever it takes, even if I feel that the only thing that makes sense to me right now is having a drink or taking that sleeping tablet. I have to do whatever it takes to maintain sobriety and to stay sober. And I think what I heard yesterday from the group specifically was that they feel that people don't really understand that. They don't really understand their struggle, and they don't really understand what addiction is about. So that's a mistake that they identified. What is the correct way of dealing with it is, I would then say, start becoming informed about addiction. Start reading up, start doing your research about it, try and learn about it. So that when your family member comes to you and they say, you know what, today I'm really going through a difficult time and I am craving, and the only thing that makes sense to me at this stage is having that drink, although I know I shouldn't, that you would be able to firstly just understand where they're coming from, and then hopefully accordingly give them the supportive and the positive and the motivational response. The third thing that they identified is, and this was also interesting to me, because I often think that that they don't really see it this way, but then at the other end, we all know that we tend to blame addicts for being very manipulative. So obviously, if that is the case, then they should know that one of the mistakes that their family members make is that they tend to take responsibility for them. So it is a very easy and almost a default reaction to blame yourself. Okay, so for example, questions like, what is wrong with me? Am I not good enough? Am I not being the best and most supportive spouse that I could potentially be? Is that the reason why my spouse, my husband, needs to continuously go out and try and have a good time outside of the home? Is that why he or she needs to continuously be under the influence because they can't necessarily deal with me? Another thing that I was told today during a family session was that a 12-year-old boy had told his dad that he doesn't believe that when mom comes home after rehab that she would necessarily be able to maintain sobriety. And when dad inquired about this and asked him about it, the response of the boy was, well, isn't it our fault that mom is drinking? Isn't it because we are making her unhappy that she is drinking? And that is typical of a family member that can't necessarily make sense of what is going on in this family system of mine. Why is it that mom is constantly under the influence? Why is it that she doesn't want to spend time with us? Why is it that she can't necessarily engage with me? It should be something that's wrong with me. And in doing that, they are actually taking responsibility and accountability for the problem. And this could potentially reinforce the addict to manipulate it and to say, well, you know what, if you were different, or if you achieved better at school, or if you were less naughty, then I wouldn't have to drink. And in doing that, they are effectively not taking the responsibility and the accountability. It just gives them a means to blame you for their addiction and to not necessarily address it. So it's quite important to not feel responsible and to look at possible codependent styles or behavior traits that you may have developed during the time that your spouse or your family member has been abusing the substance, and to address those and make sure that whatever it is that you're doing for the sake of supporting them or trying to help them, to make sure that it is just support and it is not taking responsibility. The fourth thing that they identified yesterday in group was giving ultimatums. Now we all know that as family members, being impacted and sitting with the situation where we are often feeling angry, like I said, angry, resentful, embarrassed, disappointed, despondent, hopeless, that we sometimes get desperate and then we make threats and we give certain ultimatums. For example, I've often heard of family members saying, you know what, this is the last straw. If you're not going to quit, then you're not welcome back in my house. I will put you out of the house. I will pack up your suitcases and I will leave it at the front door for you. What is the problem in that? Obviously, when you say that in that instance, in that moment, that is how you feel. And that's probably also what you believe you will be able to do because you are so angry and you are so fed up and you just can't anymore. The one thing is that you need to ask yourself, when you make a threat or when you give an ultimatum, will you be able to follow through on that threat and ultimatum? Because the problem is, if that person, well, your family member or your spouse, if they do not react positively to your ultimatum, and they just do quite the opposite, will you be able to pack the bag and leave it at the front door? Because if you're not going to be able to do it, then you shouldn't speak it. You shouldn't give that threat. You shouldn't make that ultimatum. Because if you can't follow through on your ultimatum, it gives them a sense of, well, there's just another area for me to manipulate. I can get away with whatever. He or she will forgive me over and over again. And that will leave you as the family member trying desperately to fix the problem, feeling more and more hopeless, more and more despondent, and completely out of control. So make sure when you make an ultimatum that you will be able to follow through on it. Okay. Then let's look at some of the other examples that was given. Sorry, I just want to have a look here. All right, the last one that was mentioned was setting clear boundaries. Okay, so I'm sure for those of you that's got knowledge about codependency, you will know that it's difficult for a codependent to set clear boundaries and to actually stick to your boundaries, because codependents very often are those people in a family system that's either people pleasers, or they're fixers, or they're rescuers, and they are also what we would call the empaths. So they react upon their emotion. When they are emotionally overwhelmed by a situation, they will react on what they feel. So if they feel hurt, they will cry, and they will most probably then make a threat and say, I can't do this anymore. I can't go through this disappointment, this pain, this hurt anymore. If you are not going to quit using the substance, then I'm going to file for a divorce. There you go. You've made a threat. Have you asked yourself whether you would be able to follow through on the threat? Okay. So rather than making that threat or giving that ultimatum, look at what is it that you are comfortable with and that you are not comfortable with, and set that boundary. Okay. So for instance, for example, you are allowed to say, I am not comfortable with you drinking at home, especially in the presence of our children. And if you are going to choose to continue to do that, then I am going to have to move out and move in with my parents. And I will have to take the children with me. That is setting your boundary. But again, to go back to the previous point that I made with giving ultimatums, again, when you set your boundary and when you give an ultimatum and the boundary that you've set is not respected, then you need to know that you're going to have to follow through on what is the repercussions of not keeping to the boundary. Okay, so setting a boundary would be something like, I'm not comfortable if you use substances in my home, in the presence of my children, and then also calling out what the repercussions of not respecting this boundary would be. Okay, so from the group yesterday, what I heard is it is often a case of boundaries are set. You're not allowed to drink anymore. Whenever family is visiting us and we're having a braai or whatever, I'm going to ask you to not drink anything because I cannot control the amount that you're drinking. I cannot control how you're going to be behaving after this. And when it actually comes to that point where the braai is going on, then typically the pleaser and the empath would feel, but I'm being nasty now, and I'm controlling you now, and I'm not being fair to you now because you're an adult yourself. And then they would typically come to you and say, oh, you know what, it's okay, just have one, but please, just one. There you have actually moved your own boundary. And what is the message that you're giving your family member there? That I am okay with being uncomfortable to make you comfortable. Even if your comfort that I'm allowing you to have right now is destructive and dangerous and has got very dangerous consequences for our relationship and for our children. So again, when you set your boundaries and when you call them out, as things that you are comfortable or uncomfortable with. Do not make the mistake in reacting upon emotion at a later stage and moving the boundary yourself in order to please the other person, because again, that gives them room for manipulation. Families, I hope that I've given you some advice and some guidance and some ideas as to how to go about not dealing with the problem, and then at the other end, hopefully dealing with the problem. But I think at the end of the day, the most important thing for me is to continue talking, to be transparent, to discuss, to ask when you don't know. If, for instance, you see that your family member is having a bad day for whatever reason, to check in with them and to say, I'm not really sure how I should go about dealing with you today, because I can see you are reserved, you're quiet, you seem a little bit agitated and irritated. And I don't want to be judgmental now, and I don't want to be the one to tell you, but okay, you are probably craving, or you may have already had something to drink. So tell me, how do I deal with you now? How can I support you right now? So communication is still the very best way of supporting and going about dealing with struggles within any relationship. Good luck with this. Hope to hope it will be helpful for you, and thank you for listening. Bye bye.